Good evening. My name is Dmitry Gerasyov. Currently, I work as a doctor and a physical therapist. I work at the largest private medical center in the city of Novosibirsk, the famous clinic called Zdravitsa. I practice physical therapy there at the moment, although my journey in the medical field has been a diverse and fulfilling one, having gained experience in multiple disciplines. I commenced my career as a pediatrician, then worked as an anesthetist resuscitator in a neonatal intensive care unit, as well as a blood bank doctor. In my pursuit of holistic healing and comprehensive care, I delved into the realm of rehabilitation techniques, specifically focusing on massage therapy for infants and children. This invaluable experience propelled me towards my current path as a physical therapist. I honed my skills and expertise in physical therapy through a year of dedicated practice at a resort center. In 2013, I became acquainted with singing bowls. Actually, I've always been interested in this topic, and in 2016 I took Dr. Surikov's basic course here in Novosibirsk, and I started introducing his techniques to my physical therapy office. I had a lot of people coming to rehabilitation procedures, and it turned out that these approaches were really effective. People would just fall asleep during the session, in some cases for 4 or 5 minutes. Picture this: a big guy walks in, lies down without even intending to get rest since he has other procedures to rush to. But next thing you know, he passes out and you can hear him snoring. You glance under the massage table and find a completely relaxed face, mouth gaping. He's in the arms of Morpheus. Combining these techniques with physical therapy yielded terrific results. Later, I also discovered that osteopathy goes well with them too. This harmonious blend of therapies holds tremendous potential for enhancing outcomes across diverse healthcare fields. During my tenure in the intensive care unit, I developed a profound appreciation for the role of fluid dynamics in patient care. Adhering to a fundamental principle, I learned that less is often more when it comes to fluid management. Thus, vigilantly monitoring and regulating bodily fluids became a crucial aspect of patient treatment. At times, it became necessary to swiftly address fluid imbalances, employing various interventions to restore equilibrium and alleviate excessive fluid retention. And it's hard to do that. Imagine a baby that was born with acute hypoxia. Unassisted breathing is impossible, and the heart rate is abnormally sluggish. As a result, it's put on mechanical ventilation. It experiences terrible problems with gas exchange, heartbeat, fluid, and electrolyte balance. It suffers from edema. When your shift comes, you know that other doctors have been treating the baby with intravenous loop diuretics in dosages much beyond the baby's weight restrictions for 2 days without success. You come up, you take a bowl and hold it about half a meter, 1.6 feet, above the open resuscitation system. You start rimming the bowl gently, and the urine begins to drip along the catheter, slowly, drop by drop. The swelling subsides, the brain emerges from a coma, the baby starts waking. First one case, then another, and so on. Soon, our entire neonatal intensive care unit came to believe in this approach. That reminds me about people with severe localized edema, such as a knee joint injury in adults, when the knee swells to the size of a baseball and the patient is ready to go for an X-ray and a puncture. Since I myself have undergone 3 knee punctures as a result of the lateral ligament rupture, I know how painful this operation is. So, I tell that lady, hold on. The next day I bring my bowl. It only took us 2 sessions, and no puncture was necessary. Her knee came back to normal. I think this is a very advanced technology compared to puncturing a knee with a needle and pumping out around 100 milliliters, 3 ounces, of fluid. I encountered a fascinating case involving bladder stones in an elderly patient. Well, initially, she approached me with a simple request for structured water, which she consumed regularly. She returned after 5 days, sharing her discovery of having stones. We invited her to lie down and conducted a contact session with her. She returned the next day with a bag containing a stone measuring 13 by 4 by 6 millimeters, 0.5 x 0.1 x 0.2 in. While she chose to retain the stone, we documented its presence through a photograph. These are only the cases that spring to mind. It is a very promising technique. I intend to continue developing in this area. One bowl is good, but a whole set is much more effective. Besides, contactless practices offer a variety of advantages, such as when you work with newborns, pregnant women, patients in critical condition, and such patients do come to both osteopaths and physical therapists. You can't accomplish everything with just hands. Hands are not refined enough to work with some aspects of human health.
Do you mean to say that a singing bowl in the hands of a doctor has great power?
Yes, it's the best tool I've ever had. To be honest, I can no longer work without bowls. My bowl broke once. It cracked, and I felt like I'd lost an arm. I emailed Dr. Surikov right away, he lived in Gorno-Altaysk at the time, to order a replacement bowl.
Okay, what if I'm not a doctor? Is there a point in getting a bowl then?
Of course there is. It's a wonderful tool for self-help, self-recovery, self-healing. I've got 2 kids, and even my youngest, when he gets a stomachache, he pokes at the bowl, meaning, rim it on my stomach and my back. He's only 3, but he already understands it helps, because bowls are so effective.
You finished the basic course, and you've just told us about the results. Is there a point in taking any further courses? What are you planning to do next?
It is absolutely necessary to move forward, because the basic course is mostly about self-help, about the use of singing bowls at home. I have to admit that I chose to take a chance and use it on other people, without completing any more training, as I had some medical experience after all. Well, it did work, more or less, but I still have to feel my way, and I can't see the light at the end of the tunnel. I'm going to take the 2nd and the 3rd courses of the intensive program in the nearest future, in September. I have no choice but to move forward. When you're a doctor and you come across something like a singing bowl, there's a reason for that. You shouldn't just go with the flow, you should learn. This is something that my friends, Buryat shamans, told me. By the way, in addition to graduating from Irkutsk Medical University, they also studied in a Buddhist datsang, but they'd never seen singing bowls. For them, singing bowls also became such a great revelation that they continue to come to my sessions.
So, the shamans approved of the bowl?
You bet. They regularly refer their patients to me. Those who come to them for some other reasons. They want me to scan them using vibroacoustic techniques, the things Dr. Surikov demonstrated.
But you're a conventional medicine doctor, aren't you?
Well, in general, sure. Although working in intensive care leaves an everlasting mark on you, and you realize that there are things contemporary science cannot explain, it hasn't reached that level yet. But such things do exist, and you need to do whatever you can. In this regard, singing bowls are a very useful tool.